All right, so the next most common cause of dementia, right, umbrella term, next most common is going to be vascular dementia. So the symptoms are going to sort of blend together with Alzheimer's, right? The patients are going to have some memory impairment, right? Maybe some functional impairment, could have incontinence, could have lots of different things. But rather than it being caused by these amyloid sheets and these hyperphosphorylated tau tangles, it's due to just sort of chronic reduced blood flow microvascular disease to the brain. The sort of classic description is that it's stepwise, that as you accumulate sort of stroke burden with time, that you're going to gain more and more impairment. Risk factors for these are going to be the same vascular risk factors that you see with everything, right? So smoking, hypertension, diabetes, hyperlipidemia. The imaging is not specific. The treatment is to fix all of the things that's causing it. Ignore that next part. And I'm going to go on to this. So additional vignette tips for me that I think are helpful in delineating that the person has vascular dementia. They're typically going to describe their neurologic exam a little bit more than they do with patients who have Alzheimer's or another form of dementia. They might like hint that they have some hyperreflexia in one limb, right? They're going to give you something that might suggest that there's an old stroke in there or there's a little bit of weakness. They almost always will give you an exact time, right? So someone with Alzheimer's will accumulate, right? They might be at the start only having trouble with this thing and then this thing and this thing, but the question writers won't tend to give you exact time points. In vascular dementia, they tend to give you exact time points. Like 8 months ago was able to do this, maybe a month ago wasn't really able to do this. They sort of will use the numbers more often. And then almost always in that sort of first line, or second line, they'll emphasize some sort of non-neurologic history that suggests risk, right? So they'll mention that the person had a coronary artery bypass or that they have diabetes, and then they'll give you that they're on like multiple medications, right? So they're on insulin and they're on glipizide, they're on multiple, whatever they may give you, rather than sort of just mentioning that they have a history. So they'll sort of really sell that non-neurologic. That's just the personal experience things. This MRI is a little hard, right? So this person has they have big ventricles, but you can see these white matter changes, right? So right around the ventricles, whenever you see white matter disease, that's kind of where they show up.